Is hyperopia a common refractive error? Imagine looking at a distant object and noticing it appears blurry, even though your eyes feel fine. That's often caused by a refractive error, which affects how your eyes focus light. One of the most common types is hyperopia, also known as farsightedness. While it might not be as talked about as nearsightedness, it is actually quite common worldwide. Hyperopia happens when the eye is shorter than normal or the cornea has too little curvature. This causes light to focus behind the retina instead of directly on it, making nearby objects appear blurry. People with hyperopia might notice they need to squint or strain their eyes to see clearly up close. In the United States, studies show that around 10% of adults aged 40 and older have hyperopia. These numbers can vary depending on the study and how hyperopia is defined. For example, some research in Iran found that about 12.5% of adults between 31 and 70 years old have hyperopia. In contrast, some studies report lower rates, like 3.5% in adults over 20. These differences are due to factors like age, ethnicity, and how doctors measure hyperopia. Globally, refractive errors like hyperopia, myopia, and astigmatism affect a large part of the population. When these errors are not corrected, they can cause visual impairment and reduce quality of life. Correcting hyperopia usually involves glasses, contact lenses, or refractive surgery, which help focus light properly on the retina. From an eye health perspective, recognizing hyperopia is important because it can influence the diagnosis and management of other eye conditions. For example, hyperopic eyes tend to be shorter and may have different features that relate to the risk of glaucoma. Proper correction also supports overall eye health, especially for those with age-related conditions like macular degeneration. In summary, hyperopia is a common refractive error affecting many people around the world. Its prevalence varies by age, region, and individual factors, but it is an important condition to identify and correct. If you suspect you have hyperopia or notice vision changes, it's always best to see a care professional for a thorough exam and personalized advice.